Welfare Committee to order, and myself and Mr. Marquise Harris Dawson present. I'm going to put item 1, 2, and 6 on consent without objection. So if you're here for those items, you don't need to stay. And we'll begin with general comment. We have one speaker, Gus Malkin from SEIU Local 721. And you'll have 2 minutes.
Good morning, Council Committee. My name is Gus Malcolm. I'm a civil engineer, project manager with the Department of Public Works Bureau of Engineering. I've been working for the city for the last 29 years. I'm a civil engineer, project manager. I work on managing the air treatment facility program, which is worth about $100 million for the last 12 years. I delivered the program successfully with cost savings. 2 of the air treatment facilities were built in the President Council Air Western District, and the last one was built in the on Councilman Jose Huiza District, and they were all successful. I have outstanding performance evaluation for 8 years in a row. I have received 5 awards in my career. I'm a super performer and achiever. I have scored 102 in 2 senior engineer exams, senior construction engineer and senior civil engineer, and I'm the second on the top of the list. Where I am here is I have been receiving continued retaliation, harassment, and discrimination for 5 years. It has impacted my health and whether I do to deserve this.
You have another minute, by the way.
Go ahead,
Thank you.
They'll reset that.
So I have a case in front of ODCR, and I've been waiting 2 years for the Civil Service Commission to hear my case, and we filed the case with the unfair labor practice. And also I made some council member aware of my case. They gave me 2 notices to correct, and they withdrew them, and I won against them, and they gave me the 3rd one. They promoted 13 people below my score, and then they keep passing me on. They deny me promotion. They deny me to transfer where I could use my expertise to help the taxpayer and build successful projects. They want to send me to places where I cannot succeed. They want me to fail and have no staff. They don't give me staff. And also, I'm requesting, if it's possible, for the Council Committee to look into this matter, or please, if it's possible, to hire an independent investigator to look into this, because I need to work in a safe environment from discrimination, harassment, and retaliation. I appreciate your time, and thank you for giving me time to listen to my kid, but I've been suffering a lot, and I don't deserve this. What did I do to deserve such a blunt harassment and discrimination by the Department of Public Works and Bureau of Engineering? Thank you.
Thank you. And David Hirsch on my staff will talk with you and follow up on this.
Thank you very much. Thank you.
Item number 3.
Item number 3, Department of Fire and Police Pensions Report relative to the annual report for fiscal year 2014-15.
Good morning.
Good morning. How are you doing this morning?
I'm doing well. How about yourself?
Very good. Very good. Well, thank you. Thank you again for the opportunity. Every year we send our annual report over for council. We want to make sure that council and the city is well informed of our activities that have occurred over the last year and status of sort of investments and our budget and where things are going. We feel it's a pretty comprehensive report, and hopefully it's providing you all the information you need. So with that, I guess just a couple quick highlights. Based on the lax actuarial report, the plan is funded actuarially about 91%. On the pension benefits, we are down at 45% on health for a combined 85%, which is a very good number. I think we are much better funded than a lot of plans across the state and across the country. We are nowhere near a Chicago or Illinois type situation. The city has taken its pension contribution seriously and has always made the required contribution, which certainly has helped the plan stay well funded. As far as members, we serve over 25,000 members. Split roughly about 50-50. We still have a few more active members than we do have retirees and beneficiaries, But that is a note that we are now becoming a mature plan, and I do expect over the next couple of years that we will have probably more retirees and beneficiaries than we will have active members. With that, as that number increase or that ratio changes, what it does mean is when we have changes within our return in a given year, it will have a larger impact on next year's contribution. But like again, as long as we and the city pays its full arc, I think we're in a good shape going forward. So, yeah, are there any things that I can add or address? Any of the information, anything about investments, staff,
First of all,
operations?
How problematic is it to have more retirees than active workforce?
So to throw a little numbers out there, right now the city is going to contribute roughly a little over $600 million, probably $615, $617 million. We actually pay out over $1 billion in benefits. So just with the city's contribution, it's not enough to cover the actual benefit payments that we do have to pay each year. So that shortfall has to be made up from investments. Unfortunately, if investments are down, and this year we are down, then it just adds pressure, shall we say, actually to the city's contribution in the later years. Just things to be mindful of.
Now, just about every period you can slice, we've done better than our rate of return, correct?
If you look over the long term, we have done better than our assumed rate of return right now. I will note that if we continue at 0 or about 1% this year, we'll probably, at the 20-year, we'll probably be just at about 7.5 over the long term.
So the 0 will pull everything down.
Yeah, unfortunately, it does. You get a 1 or 2 not so good years, and it does affect your average, unfortunately.
And obviously our time during the Great Recession probably didn't help either.
That is correct. That is certainly correct. I would say over the last 15, 16 years, it has been a much different market than it was previous to that period. Just as an example, in the early 2000s, we had 2 years of negative returns. We then had 2 years around the Great Recession of negative returns. Having those back-to-back negative years hasn't occurred prior to 2000, 2001. And it certainly has an impact on our long-term rate of return.
And are we projecting that out for the next couple of years, or are we expecting something more positive?
You know what? Most of the advisors caution us these days to not be overtly optimistic on the rate of return. They do feel that at some point there's going to be a slight correction in the market. We're perhaps seeing that now, currently in the fiscal year. Going forward, they do not expect the overwhelming double-digit returns on the public equity market, so they are cautioning us. Now, what's I don't want to say ironic, but the one good news is on the private market, private equity market. They do feel that that's probably going to give us our highest rate of return. Though with that, there are fees associated with private equity. But on a net basis, we're still looking quite well. In fact, our 10-year average return on private equity net of fees is roughly about 11%.
And that's even including, obviously, a major recession.
Yes, that is correct, yes. So that's one good point, yes.
I understand that you've made some IT improvements. I wonder if you could speak to those.
So we're in our first year of a new pension administration system implementation. We started back in July, and so we're now 9-10 months into that implementation. We are looking at changing out a system now where it's one we have to rely on our IT vendor to make any changes to. It is not very flexible. And we have to use multiple systems in order for us to gather information. So we're looking and very excited to move to a new system that's going to encompass better reporting capability, better tracking of all of our member information, and we won't need to have a number of side systems that we currently use right now. So.
anything you've learned from this process that could apply to other departments that are looking at similar systems? I know personnel is moving in that direction as well.
The one highlight that I would share, and actually I perhaps took this from the FMS implementation, you need to make sure you have a dedicated team that's solely focused on the project. Don't try to draw folks from other areas of the operation and expect them to dedicate the required amount of time necessary to get that system going. You actually really need to have a dedicated team that's going to focus on the project and moving it forward.
Oh, that could be a point well taken. Mr. Harris-Dawson, anything to add? Mr. Rue? And for the record, Mr. Rue has joined us. So we will gratefully accept and note and file your report. So,
Well, thank you very much. Thank you for the opportunity to appear before your committee.
thank you. Good to see you. Item number 4 and 5. So let's take those together.
Item number 4, Personnel Department report relative to the Consolidated Reasonable Accommodation Report for the fourth quarter of fiscal year 2014-15. And item 5 is the same thing, only for the first and second quarters of fiscal year 2015-16.
Good morning.
Good morning.
Olivia Flores, Personnel Department.
Dave Noltmeyer, Personnel Department.
Don Alvarado, Personnel Department.
So these are the consolidated reasonable accommodation reports for the fourth quarter of last fiscal year and the first and second quarter of the current fiscal year. They reflect the city's efforts to reasonably accommodate employees with temporary and permanent work restrictions due to industrial and non-industrial injuries. We track both workers' compensation numbers as far as light duty hours, IOD saved, IOD spent, and we look for things to be IOD and light duty to increase while IOD spent decreases. Since these are snapshots, we really don't always see that. It kind of depends on the particular quarter. For reasonable accommodation, the reports are slightly different. The fourth quarter was a very breakdown of numbers just by department, how many they received, what was granted, and what were denied. The newer reports, the first and second quarter, now reflect not only the numbers of requests received, but how they're being accommodated, what types of accommodations are working, and we're working closer to try and get numbers as far as how long it takes us to get from a request to implementing an accommodation.
So I think we've had to settle a lawsuit or two relatively recently. How do we make sure the city's complying with all of its requirements and deadlines for these requests so we don't wind up getting sued for not being responsive?
Over the last 2 years, the Personnel Department has taken on the project of really enhancing our reasonable accommodation process. While we have great guidelines, they were too broad, and we needed to get down to how do I get from the request to an accommodation, and doing that timely. And that's what we've done, so we can have consistent and timely and correct types of accommodations. All of that is transparent to employees and employers. We have it on our Personnel Department website. We coordinate often with the City Attorney's Office whenever situations come up. And we developed a cadre of core staff who are experts in this area. Reasonable accommodation is unique in that every case is an individualized assessment. So no two cases are ever going to be the same. And the type of accommodation that we can provide really depends on the circumstance that you have before you. So we have to be more creative in how we can do that. It's been working. It's been working great. That doesn't really help us with the older cases where maybe some things could have been processed a bit better.
I'm glad to hear that we've actually moved in the right direction on this.
Yes.
So that's good news, and I appreciate it. Any other questions? If not, we will note and file these reports.
Thank you.
And thank you for the improvements in the department. Item 7.
Item number 7, CAO report relative to proposed amended and restated contract with Straticare LLC, contract number C-122496 to provide medical bill review, cost containment, and managed care services for the city's workers' compensation program.
Good morning, Jenny Yao with the CAO. The item before the committee today requests approval of a first amended and restated contract with Straticare LLC to provide medical bill review, cost containment, and managed care services for the city's workers' compensation program. The initial contract with Straticare was executed in 2013, and in October 2015, Council authorized extension of the contract through June 30th, 2018 to provide time for an RFP process to be completed and to maintain service continuity. So the first amended and restated contract provides for the execution of the term of the contract through June 30th, 2018, consistent with the Council's action, and also increases the contract's maximum compensation by about $12.7 million for the additional time approved by the Council. Funding for the contract is provided in the 15-16 Human Resources Benefits adopted budget with no additional impact on the general fund. And as the contract does provide service continuity with no increase in rates, we recommend approval. With me, I have David Noltzmeyer and Gregory Dion of the Personnel Department to answer any questions you may have.
So when this is renewed, how many years will we ask that it be renewed for again?
So it'll be through June of 30th of 2018, so an additional 2 years. The current contract expires in June 30th of 2016.
On renewal in 2018, when we renew it, then how many years are we going to ask for?
So we're right in the middle of an RFP process right now, and so we'd probably be looking at a 3-year contract, but we haven't made that determination yet.
Okay. All right. Any other questions? If not,
Quick question.
okay, please.
What's the current, before the increase, what's the current contract with Straticare? Contract amount?
So the contract maximum was about 29.5 before the increase.
29.5 over how many years?
Over 3 years.
Over 3 years. So you're asking for a $12.6 million increase for the last 2 of the 3 years?
Correct, up to that amount. Yes.
Can you kind of give a little bit more explanation of the increase, the need for the increase?
Sure. The annual compensation on the contract is based on a fixed monthly cost for the services that are provided by the contractor. So that fixed monthly cost is about I don't have it broken down by month, but the annual fixed service fee is about $2.8 million. And then there are additional variable expenditures for services that are provided by the vendor for utilization review. And that takes us up to a maximum annual compensation limit of about $6.3 million annually, or $12.6 million over 2 years.
Okay. Thank you.
Well, if there's no other questions or comments, I would ask that we approve the CAO's recommendation without objection. And hearing no objection, that is approved. Item number 8.
Item 8, CAO report relative to 3 proposed amended and restated contracts with Acclimation Management Services, Acme Administrators, Inc., and TriStar Risk Management to provide third-party administration services for managing a portion of the City of Los Angeles workers' compensation claims.
So good morning, Jenny Yao with the CAO again. So the item before the committee today requests approval of amended and restated agreements with Acclimation Insurance Management Services, or AIMS, Acme Administrators, and TriStar Risk Management to provide third-party administration services for managing a portion of the city's workers' compensation claims. So the original contracts were executed in 2012 and 2013, and in October 2015, Council authorized extension of these contracts to November 2017 to provide time for an RFP process to be completed and to maintain service continuity. The amended and restated agreements provide for an increase in the maximum compensation amount by a total of about $23 million for all 3 contracts to cover the additional time approved by the Council. Funding for these contracts is provided in the 2015-16 HR Human Resources Benefits adopted budget with no additional impact on the general fund. As the contracts provide service continuity with a 0 to less than 1% increase in rates, we recommend approval of the amended and restated agreements. And with me, again, is David Notmeyer and Gregory Gian, and we're available to answer any questions you may have.
I wonder if you could clarify the anticipated spending levels for the remaining months of each individual contract.
Sure. So for AIMS, Acclimation Insurance Management Services, the increase in the compensation limit is about $6 million over through June 22nd of 2017, and that covers the fixed monthly service fee of about $301,000, as well as variable expenditures to provide assistance to personnel to handle a portion of fire civilian claims. So there's no increase in the monthly service fee for that. So the maximum compensation amount would be sufficient to cover the additional about 22 months that is being extended on the contract. For ACME, it's the same. The increase in the compensation limit is sufficient to cover the fixed monthly service fee of about $100,000 through November 22nd, 2017. And there's also no increase in the monthly fixed fee for that contract. And then for TriStar, the increase in the maximum compensation amount is about $15.9 million through November 22nd, 2017. And there's a slight increase of about 0.7% from the second and third, from the fixed fees in the second and third years of the contract.
And was there any money left under the current spending authority for any of those three contracts, or did we completely exhaust all of it?
For TriStar, we've completely exhausted. It's the spending limit has been completely spent, and for ACME and AIMS, there's some spending authority that is still remains. So the compensation limit adjusts for that.
Oh, so you already adjusted for
Yes, correct.
that. Okay. Other questions or comments? If not, we will approve the CAO's report as recommended. And I believe we have no other cards or business before us, so we are adjourned.